Thank you. Commissioner, as you can see under budget hearings, the time constraints, while understandable, are really not conducive or beneficial to the necessary interaction to properly perform yours and our responsibilities. When you appeared for confirmation, you agreed to make yourself available despite time demands. So are you ready here today to commit to us and to the members and publicly that you will appear before committees of the legislature when you're invited to afford a more thorough opportunity to examine, discuss, and answer questions on these health policies and procedures that affect New Yorkers?
I have always done so.
Commissioner, you have not thoroughly done this. I just want you to say today you will, and you're ready to do it, because when we've had meetings with you, it's been limited, 30 minutes, 2 questions. Will you commit to just being available to do that? You can see this frustration. Will you be willing and ready to do that?
I am always willing to speak with the legislature, and if there was a commitment on time, there was discussion that said, I remember what you're referring to about the 2 hours, whatever period of time that we discussed back in the summer. I assume that's what you're referring to.
So this is just a yes or no. Are you willing to do it, Commissioner?
I said I'm willing to work with the legislature.
Because if you're evasive on this, then you're not prepared to do it. Will you accept the invitation to appear?
I will appear and speak with the legislature if asked about issues.
Thank you. I appreciate it. Commissioner, the question is on providing funding to long-term care facilities throughout the pandemic. Has that come predominantly from the federal government, or have we allocated resources from the state also?
I'm trying to understand what your question is. There's money that comes from federal, and there's money that comes from state.
Pandemic-related money like CARES, things of that nature. Has all of that been applied? How's it been applied, and where applied?
I need to get back to you about the specifics of what proportion from the CARES Act has gone to where, but I will get that to you.
And then specific to the new variant that's been identified, I know you're starting to study this. Do you know how it will affect the efficacy or the existing therapeutic treatments?
So that's a great question. And the fact is that we do know that this new variant and how it impacts patients is that the virus needs to get into a cell. The way all those little spike proteins around there, things hook onto the cells, your body's cells, and it gets into it. And some of these variants are able to make it more sticky so they can get into the cell. Once that happens, you end up with the risk of a more potent infection in the individual. And so we don't know yet about this particular new variant of B156 that we were talking about before, because we're learning about it. The virus always mutates. It continues to mutate. We've seen many mutations. It's just that every once in a while, the mutation falls within the area that actually affects how it can get into the cell, which is a critical issue. The vaccine is designed against the spike protein because that's what we're concerned about. All the vaccines are, whether the messenger RNA vaccines, the adenovirus vaccines, all of them are designed that way. So we're going to have more information about it. So once I can have more information, I'm happy to share it with you.
Thank you. We look forward to you appearing with us very soon so we can have a more thorough conversation.